Hey guys, Dr. Berg here. Listen, I had a recent question that related to can a woman control where fat burning occurs? Because they had heavier hips, but when they started doing the program, they lost mainly the upper part of the body first. So I'm going to talk about why that is. Unfortunately, the body will go after the intraabdominal fat first. That's the visceral fat around the midsection, okay? Before you get to the lower section. Then it'll work on the subcutaneous fat in the upper part of the body, and lastly the lower part of the body, the hips and the thighs. Now, one little point about the hips and the thighs, about 50% of that is usually, from my observation, more of an atrophy situation, not all fat. So when you start losing, you're going to have to start building the muscle underneath the fat, okay? Because atrophy is a loss of muscle tissue. Now, just by doing the intermittent fasting and the ketosis, you're going to improve your muscle. You're going to salvage that. But you're going to have to do something to get a lot of blood flow going in the areas that you need to tone, because that'll bring in more hormonal health. So we want to handle the atrophy. I've actually put a video down below of, I have 3 videos on atrophy. You can check that out. Okay, so when you exercise to improve the atrophy and you work that muscle, you want to do a combination of high intensity interval training, okay, to stimulate growth hormone. But you also want to work on specific body parts. You probably want to get a personal trainer or someone that has some knowledge to really work out the entire body, especially the areas that you want to work on, mainly for the muscle development and the contouring and the tightening. The other point I want to bring up about that is you want to make sure that you don't overtrain, or else you're not going to get anywhere. I had a gal who came in the office. She lifted 3.5 million pounds over a course of a year and lost 2 pounds. Okay, so she's working out massive weights, overtraining. Okay, overtraining. So I put her on a completely different workout of like once or twice a week. She started losing. She started getting improvement. So you really want to make sure your sleep is good. You want to make sure that your recovery is really good, and maybe twice a week would be perfect. Give yourself time to recover. Very vital. About 85% of the improvement in both men and women will come from your diet. So that diet has to be really squeaky clean, and a combination of keto and intermittent fasting. For those of you that have never seen those videos, I put some links down below. And 15% of it is actual exercise. So if you think you're going to just do it with exercise without the diet, good luck. It's not going to happen, especially if you're over the age of 30 or 40 or 50. And then we come to this thing called estrogen dominance. A lot of women that have heavy cycles or hot flashes or have weight in the lower part of the body are estrogen dominant, okay? I put some links down below of what to do if that's your situation, but that could inhibit your weight loss simply because estrogen puts the fat on the lower part of your body. So you're going to have to also really make sure that you don't consume any hidden estrogens, any food that mimics estrogens, especially the soy. So you're going to have to do more organic, things like that. The other thing is that during menopause, the relative ratio of estrogen will be higher than progesterone, because your progesterone just crashes. So you have this ratio of now you end up with like heavy estrogen, low progesterone. In that situation, again, you're going to have to consume foods that are anti-estrogenic, simply because that could be the reason why you're heavy in the lower part. So kale, Brussels sprouts, broccoli, all that is really important to help balance estrogen. There's some other things as well. I'll put it down below. But the point is that, unfortunately, you can't necessarily target the lower part of your body with weight loss right off the bat. It's going to take some time. Now, the estimation of effort is probably going to be more than you think. If you're frustrated, you're at the gym and you're trying these things and you're not seeing anything with your thighs or butt, honestly, you may have to wait 6 to 8 months to see some significant change, okay? Sometimes up to a year or more. Why? Just because the body sometimes has been broken down so much, it takes a while to repair, because it's all about getting healthy first, then lose weight. The thing that you want to look at is, are you losing inches in your stomach? Are you feeling better? Are you sleeping better? Is your stress tolerance better? Hang with it. Keep going. It's eventually going to come off. And then with the other things with exercise, you eventually tone the lower part as well. This is just based on observation. All right? Thanks for watching. Hi guys. Hey, listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now and we'll send you a report.